Good morning, everyone.
Hi, I'm Dr. Steve.
And we are here to present some what we think is wonderful material for everyone. And what is that material that we're presenting today, Steve?
We're going to be talking about perhaps the most essential nutrient that relates to success of dental implants, and perhaps a nutrient that many of you have not heard about and may not have even had a blood level tested, and it's vitamin D.
And Steve, if you were to ask one salient question to our audience, what would you ask?
I would say, what is your vitamin D level?
Excellent. Vitamin D levels are thought to be very low in a great number of the percentage of our population. Okay, so some studies show that it's about 42% of the population is low in vitamin D, up to maybe even 70%. And magnesium is the same. At least 45% of the population is low in magnesium. Both of these are involved with hundreds of physiological processes in the body.
Totally. Most people say, well, I'm out in the sun, I ski, or I'm out in the garden, and so I'm totally okay getting vitamin D, because many individuals are aware that sunlight is important, is essential for vitamin D conversion in the body. But studies have consistently shown that if you live north of Atlanta, and we're assuming that is true of many of you, you are deficient in vitamin D.
And even if you're out in the sun, as Steve is saying, it depends on what part of how near the equator you are. But be sure to have your arms exposed and your legs exposed, because you want to get the surface area of your body exposed to catch that vitamin D. But more than likely, if you're in the northern hemisphere like we are in the United States, here in this part of the United States, you have to supplement, and you want to supplement with a good, most people would say a D3, which is a animal-sourced vitamin D. But there is a plant source in case you're vegetarian, and it's a D2 supplement then. And both of these will be converted in the body, converted to what's known as, it's going to get technical, so grab your seat. It's 25-hydroxy vitamin D. That's really the active molecule, and that requires magnesium to become that active molecule. But vitamin D will benefit your overall health. Isn't that true, Steve?
Correct. Your immune system, it's been involved in studies showing that it helps with blood pressure, it helps with blood sugar, all of these conditions that you are probably aware of and are trying to stay on top of. We do recommend, before you really go out and start taking supplements, because when you go to the store, you'll see that there's all types of varieties. That the first thing is that you consult with your physician and ask them if they would order a vitamin D level
and a magnesium.
Definitely. They may want to order some other levels too, but at least the vitamin D, sadly enough, is not routinely requested, and it's not out of the ordinary. It should be covered under your insurance, or it's not going to be very expensive. And then when you get that result, since we're sharing with you the results of our research, but we are not here to give you specific medical advice. So we strongly urge that when you get the results, consult with your physician, and your physician will guide you as far as how much to take. Because if you happen to be very low, you may want to start with a very high dose for a month or two, and then get another test, and then go down to what's called a maintenance dose. It's a very simple, easy protocol to follow, and as Len is saying, it is way beyond just bone health. It's your total immune health, your resistance to infection, and basically 300 metabolic processes.
Yes, both vitamin D and magnesium. And when one is taking vitamin D, it's important to even consider taking vitamin K, and one of the subgroups of vitamin K is called M7. Have fun. Look online.
We'll be posting articles. So for those of you who want to do additional research, we can give you some articles, and you can dig a little bit deeper. But the take-home message today is that while you're waiting to make your decision, please consult with your physician. Talk to him about vitamin D.
Yes. Thanks so much for listening to our program. And anyway, we wish you well.
Bye-bye.